All right, let's talk about something that drives so many people crazy: lumbar spinal stenosis. If you've ever found yourself staring at a giant wall of back braces in a pharmacy, just completely overwhelmed and wondering which one, if any, could actually help you walk farther than your own driveway, then you are in exactly the right place. Let's dive in. First things first, I want you to think about the grocery store. If you have spinal stenosis, you know that exact feeling. Leaning over a shopping cart feels like a miracle. It's like a life raft in a sea of pain. I'm here to tell you that is not in your head. It is the single most important clue to understanding what's happening in your back, and is the absolute key to finding a brace that actually works. So here's the bottom line. This whole problem is mechanical. It's just physics. When you stand up straight, your lower back naturally arches backward a little bit. We call that extension. And for you, that motion physically narrows the canal where your nerves are trying to live, and it pinches them. But the moment you lean forward, your spine flexes, and that simple movement opens that space back up, giving those nerves some breathing room. And just like that, the pain goes down. It's really that simple. So let's really dig into this shopping cart thing. We're going to break down exactly why that simple act of leaning forward provides so much relief. Because once you understand this mechanism, everything else about choosing the right tool to help you just clicks into place. You know that heavy, achy, cramping feeling that starts in your butt and creeps down your legs the longer you walk? Well, it has a name: neurogenic claudication. And honestly, the best way to picture it is like a traffic jam for your nervous system. When you stand up straight, the road narrows down to one lane, and all the nerve signals get backed up. The moment you lean forward, you're basically opening up a whole new lane, and everything starts flowing again. And we're not talking about some tiny imaginary change here. Research shows that just by leaning forward, you can increase the space available for your spinal nerves by 15 to 20%. Now, that might not sound like a huge number, but trust me, when a nerve is being squeezed, every single millimeter of extra space feels like a massive victory. It's the difference between stopping and keeping going. And this all boils down to the one and only job of a back brace for spinal stenosis. It is not about warmth. It's not about some vague feeling of support. The goal, plain and simple, is to physically stop your spine from extending, to block it from arching backward. If a brace can't do that, it is the wrong tool for this job, period. So, if that's the problem, what's the solution? How do we find the right brace? Let's cut through all that noise and all the confusing options out there and focus on the one type of brace that's actually engineered to solve this very specific mechanical problem. Okay, here's the breakdown of what you'll see out there. First up, you've got those soft, stretchy corsets from the pharmacy. They feel nice, maybe for muscle strain, but for stenosis, nope. They're completely useless because they're too flexible to stop you from arching your back. Then you have the semi-rigid ones. A little better, they've got some flimsy stays in them, but they often fail you when you get tired on a longer walk. The one you are actually looking for is the rigid LSO. That stands for Lumbar-Sacral Orthosis, and it is the gold standard because it's built to do that one crucial job: block extension. A rigid LSO works in two really clever ways. First, and most obviously, that hard plastic panel in the back acts like an external wall. It physically stops your spine from arching backward. But second, when you pull the front tight, it increases the pressure inside your abdomen. This creates a kind of supportive balloon in your belly, which actually helps to lift some of the load off your spinal discs. We're talking up to 30%. Now, here's a pro tip for you. If you want to sound like you know exactly what you're talking about with your doctor or your insurance company, just remember this code: L0631. That is the specific medical billing code for this type of rigid brace, the one that controls that forward and backward arching motion. Knowing this code is a huge, huge advantage. Okay, so knowing which brace you need is one thing, but that's only half the battle, right? Now we've got to get into the practical side of things. Does the research say it actually works, and how in the world do you get insurance to pay for it? The research on this is really fascinating. What it shows is that while these braces only lead to a moderate improvement in pain scores, they show a significant improvement in walking distance and overall function. And let's be honest, isn't that the real prize? It's not about getting your pain score to a 0. It's about being able to walk through the grocery store without stopping, or going to your grandchild's soccer game. It's about getting your life back. And this brings us to a really crucial point about setting your expectations. A brace is not a cure. It can't magically dissolve the bone spurs that are causing the problem. The absolute best analogy I've ever heard is this: it's like reading glasses for your spine. You put them on to help you perform a specific task, like walking or standing, and you take them off when you don't need them. Now listen very closely because this is probably the most important slide for anyone who's hoping to get this covered by insurance. Medicare and a lot of private insurers have what's called a 5-year rule. This means they will generally only pay for one back brace every 5 years. And that's a huge deal. It means if you get a cheap, ineffective brace for a simple muscle strain, it could block you from getting coverage for the expensive rigid brace you actually need for your stenosis a year later. Getting it right the first time is absolutely critical. So here's your cheat sheet, your playbook for navigating the insurance maze. 1, you need a prescription that specifically says lumbar spinal stenosis. 2, make sure the diagnosis code is specific, not just low back pain. 3, your doctor's notes need to mention that the brace is needed for activities of daily living. And 4, of course, you have to confirm that no other brace has been billed in the last 5 years. All right, let's tackle the #1 fear people have about wearing a back brace. It's the big one, the idea that it's going to make your core muscles get weak and waste away. It is a totally valid concern, but when we're talking about stenosis, it's largely a myth. Let me show you why. This quote just reframes the whole issue perfectly. The real cause of muscle weakness for people with stenosis isn't the brace, it's the pain. When it hurts to move, you stop moving, and that is when your muscles get weak. Think about it. If a brace reduces your pain enough to let you walk for 30 minutes instead of only 5, your muscles are getting more of a workout, not less. The key is to use a really smart strategy called activity-based bracing. You do not wear this thing 24/7. It's not a cast. You use it as a tool for a specific job. You wear it for active things like standing, walking, shopping, or cooking. And then you take it off when you're sitting down, driving, or just relaxing. It's there to support activity, not to be a permanent fixture. Okay, we have covered the mechanics, the real solution, the costs, and the biggest myths. So let's wrap all of this up with a clear, simple action plan to put this knowledge to work for you. I want to end with this quick story about a woman named Martha. For her, victory wasn't about running a marathon. It was about walking to her own mailbox without that sharp, vice-like pain forcing her to stop. She didn't sprint, the ache was still there, but that stopping pain was gone. And in that moment, her world had just gotten a little bit bigger again. And that's the real goal here, isn't it? It's not about perfection, it's about participation. So what's your single most powerful next step? What can you do today? It's simple. Log into your doctor's patient portal or just call their office and ask one simple question. What is the specific diagnosis code for my back pain? If it's something specific, like M48.61 for stenosis, you know you're on the right track. If it's just a generic code for back pain, well, you now know that you need to have a much more specific conversation with your doctor. So let's end with one final check. Is a brace like this right for you? It's pretty simple. If your pain gets worse when you stand and walk, but feels better when you lean forward on that shopping cart, that's a huge green light. But if your pain is actually worse when you're sitting, or it never really changes no matter what position you're in, then a rigid brace like this is probably not the answer. The only question left is, which path does your own experience point you down? Thanks for tuning in.